Okay, let's talk about different polyp types. As you know, March is Colorectal Cancer Awareness Month, and today we're going to talk about polyps. Let's get into it. There are essentially two main types of polyps that you should know about. One is called hyperplastic. The other one is called adenomatous or adenomas. Hyperplastic polyps are pretty harmless. They don't turn into cancer. Sometimes they go away on their own, but sometimes they can look like adenomas. For that reason, even if I see a polyp that looks hyperplastic, I take it anyway. Now, adenomas are the ones that we need to watch. Some common types of adenomas are a tubular adenoma, a tubulovillous adenoma, a villous adenoma, and a sessile serrated adenoma. All of these land in a different place along the spectrum of completely benign polyp, like a hyperplastic polyp, all the way to a precancerous polyp or a polyp that harbors a small amount of cancer in it. The behaviors of these types of polyp can put you at higher risk of developing colorectal cancer if you are not screened properly or if they are left alone. Now, in the order of least risky to most risky, tubular adenoma tends to be the least risky. Then tubulovillous adenoma is a little riskier. A villous adenoma is even riskier. And then a sessile serrated adenoma tends to be a little bit higher risk than most. The other thing we look at besides the type of polyp is the size of the polyp, the location of the polyp. The ones on the right side we want to be a little bit more careful about. Is there any kind of ulceration of the polyp? Does it feel like it's fixed? Is it a flat polyp or does it have a stalk on it like a mushroom? And then the number of polyps. If it's one polyp, okay, fine. If you have like 10, 15, 20 polyps, we have to watch you a little bit more closely. So what does that mean? When do you come back? If we do a colonoscopy, we don't find anything, 0 polyps, or even sometimes just a small hyperplastic polyp, your next colonoscopy can be 10 years later. If we find an adenoma, even if it's just one, your next colonoscopy, the latest it can be is 5 years from the time of when they found the adenoma. If you have a higher risk type of adenoma, like a sessile serrated adenoma, for example, you need your colonoscopy probably closer to around 3 years. And then anyone that has multiple polyps or the really high risk polyps, sometimes you'll need a repeat colonoscopy as early as 3 months later, 6 months later, or a year. And that is generally discussed with your endoscopist, whether it's a colorectal surgeon or a gastroenterologist. So if you are age 45 and you have never had colorectal cancer screening, I highly recommend getting it. Colonoscopy is the gold standard. It's the one I recommend. It's the one I'm going to do. Colonoscopy, colorectal cancer screening, get those polyps out before they turn into something that you don't want it to turn into.